What's going on, everyone? Today, we are joined by Dr. Okey Enyia, Senior Policy Advisor for Alliance for Health Policy and founder/CEO of Enyia Strategies, LLC, a health policy consulting firm that provides advising, policy analysis, legislative strategy, and many other services for individuals seeking measurable ways to influence policy on issues related to health equity, health disparities, and social determinants of health. Dr. Enyia, welcome to the show.
Thank you so much for having me, Winston. I look forward to the conversation.
Absolutely, absolutely. Dr. Enya, I know you've done a lot. You have quite the story to tell. And I kind of just wanted to tee you up telling your superhero origin story by introducing to the audience the title of your book, Indisputable: The Story of a Favored Son. You take us through an entire journey from life, the academic journey, professional journey. So, can you just tell us a little bit more about yourself, why the title of the book, and what's your story been so far?
Absolutely, man. I again thank you so much for holding space for me to share. I've been blessed, and I believe that to whom much is given, much is required. And I've been very intentional about being transparent about my story. So um, my story. I start off, kind of talk about my childhood, going to high school, college, med school, going to Capitol Hill, and then getting into my doctoral program, which I just finished up. And um, and I'm doing that as a conscious Black man, and the first
Wow.
son of 6 kids of Nigerian immigrants.
Mm,
And because I grew up in a family that valued valued hard work and education and other values, I always have had an interest in giving back. And so I knew that with the obstacles that I've had to overcome to get to this point, to actually finally get my hard copy dissertation, which I got last week, as
mhm.
well as my diploma
Yes,
from George Washington
sir.
University.
Yes.
This is a testament of a culmination of a background in medicine,
Mm,
public health, and health policy.
mm.
Um, and so I'll share just kind of a snippet of kind of some of the challenges that I've had to overcome to get to where I am to provide some context. And so, for example, um, I got into college, and I was the only Black male in my college. I went to a predominantly white institution, and I majored in bio and biochemistry. And so, I was the only Black male there. I had issues with my advisor, who told me after the first semester, because I think I had gotten some C's and D's in like chemistry and physics. He said, he knew that I had an an interest in going into med school, but after that first semester, when we saw my grades, he said, med school might not be where you kind of want to go. I was crushed
Mhm. Mm.
because I'm like, well, this is my first semester. I think we all have to start somewhere,
Right.
and I don't subscribe to what you're telling me. And the interesting thing about that experience, though, is that it actually fueled my motivation to prove him wrong, but also to make changes that I needed to make to have an upward trend in my GPA from that point forward, where I actually ended up
Ah.
graduating with, I think, so I started off with like a 2.3 GPA,
Mm.
and I finished up my last year of college. My average GPA was a 3.9, and I
Wow.
graduated with like I think like a 3.23 overall. And so I definitely continued my journey to get into med school, which involved taking the MCATs 4 times.
Wow.
Um, yes, over the course of a decade, and applying to med school 4 times before
Wow.
finally getting into med school
Wow.
over the course of a decade.
Wow.
I was also so post college, I was working full time. I was studying for the MCAT. I had a lot of other things going on, and so I was able to get into med school. But then I discovered that my vision was bigger than seeing patients as a physician. And in fact, getting into med school, I knew that my academic trajectory was going to involve multiple degrees, and I didn't know what that looked like.
Okay.
Um, so I actually ended up leaving med school after 2 years and going back home to kind of recalibrate and get myself together
Mhm.
because I was, you know, one of a few black men in my cohort in med school, and there was no support there for black men.
Mm.
So that was very challenging. But I knew even then that I was called into some aspects of medicine, public health, and health policy and equity um, and advocacy and other areas. So I went back home. I said, okay, let me get the MPH then. So I got into the MPH program at Chicago State University
Mhm.
in 2012.
That's a predominantly black institution, correct?
Yes, it
Chicago State?
is.
Okay.
A great point because it was such a remarkable transition from
Mm.
going to school in a at a PWI compared to a an MSI,
Mhm.
a minority serving institution where there were black faculty, black students, brown
Mm.
faculty, brown students. It was a complete 180-degree turnaround. I mean, I
Wow.
felt nurtured and encouraged. It was so gratifying to see faculty that looked like me,
Absolutely.
and that really helped me finish my MPH quicker.
Mm.
I think the average the program was, I think, 2 years. I think I finished in like a year and a half. And then even there, I'm like, okay, well, I still had some interest in going back to med school, but that door was closed. Like I knew, like I felt like the universe was saying, okay, like that part of your life is done, but I have something greater for you. So keep going, keep going.
Mhm.
So after my MPH, I applied to some doctoral programs as well as some fellowship programs to see, kind of where I might land next. I ended up taking the GRE 4 times from 2013 to 2018.
Wow.
I had to apply to doctoral programs, I think, 3 times before finally getting into GW here
Wow.
in DC. And what made the difference was that I had moved from Chicago to
Mhm.
DC in 2014 to work on Capitol Hill and also to just kind of figure out, okay, well, what else was next? Um, and so I was very intentional about meeting with faculty at GW
Mhm.
as I was applying, which helped me overcome the average scores that I got on the GRE. Now,
Mm.
I'll also say that um, the the assessment tools that are used, the
Mhm.
GRE, LSAT, MCAT, I argue, and the data supports this, I would argue, is that they are tools used as gatekeepers, as
Absolutely.
to one really being able to get into systems and institutions, frankly, that weren't built with black and brown brilliance
Mhm.
in mind.
Right.
And so I had to pad up other aspects of my application to ensure that, okay, while he's average here, he has stellar letters of recommendation. He has a solid GPA. He's met with faculty. He's clear about uh, the, the research that he wants to do. And so those factors helped me to actually get into the one program that I got into
Mhm.
was GW. I applied to Hopkins and VCU and College Park
Mm.
and like, but that was the only one that I got into. So, and the story of my life has been that while or if I apply to certain things, that all of them will like close except one.
Hmm.
And the case with like a fellowship, that was the case with jobs, and that was the case with my doctoral program.
Wow.
So fast forward, here I am, and I'm happy to kind of talk about my experiences in my doctoral program, which I think are important to share because many Black and Brown students have experienced similar obstacles and challenges in terms of finishing their degree.
Mm.
Um, so I'll pause there, but I definitely want to kind of hold space, for kind of going deeper into my experience.
Yeah, absolutely. Well, number one, thank you so much for sharing that. I think this is definitely the most compelling story we have had on the podcast because there's resiliency, there's determination, there's self-belief. Like you said, one of the things that I feel like really stuck out to me is the hard work as well, and your ability to just keep going. And I think it speaks to the beauty that not everyone has a linear path, and it
Hmm.
doesn't always have to be so linear. And I think your passion also clearly is exemplified, I think, in your career pathway because you worked at the same time and
Right.
really was able to get experience. It's not like you took a break. So I think a lot of people just hearing that is amazing. And I also would have to call out, and I think we'll segue in, well, I'll use this to segue into talking more about your doctoral experience,
Hmm.
is I think amongst everyone that is pursuing these type of careers, high achieving, sophisticated degrees, medical degrees, going into healthcare, it's a lot of pressure on us. And I
Hmm.
think particularly from a cultural standpoint, as you said, Nigerian immigrants, I can only imagine the values that your parents instilled in you as a young boy who was going to grow up in a Nigerian household, but as a black boy and black man in America, in a city
Hmm.
like Chicago, there was a lot of things that you were going to have to balance. So I would love for you to just slightly touch on just how your upbringing kind of has allowed you to continue to exist in these spaces and speak on some of the things that I'm sure you also experienced as a part of your doctoral program
Sure.
under this identity.
Yeah. So, I have grown to a place where I have about 8 to 9 core values, and those
Mm,
include accountability, integrity, excellence, transparency, humility, and a few others. Having agency, and so those are all values that I didn't know were instilled in me at a very young
mm,
age, but and it wasn't until I had matured and continued to surround myself with mentors and advisors to kind of pull out and identify those traits to help me stay grounded and focused
mm,
on the goal. And so yes, I was blessed to have parents and family to help shape me into someone that was open to change,
mm,
being flexible, and adapting to what life was bringing.
mm,
Um, and it's those traits uh, that were brought to bear in my doctoral program. In fact, what I found is that like your character, it's your core character that really helps to keep you rooted and grounded in how to navigate different spaces where you'll find yourself isolated or ostracized or rejected
mm,
or betrayed, which are all experiences that I've had over the years, but definitely in my doctoral program where I
mm,
was one of two black men in my cohort of about 30 students, and
Wow.
there were three black women. And so I had to work through one, having my competence questioned, having
Mm,
my character questioned by faculty and staff and students, having my uh, field um, of interest and scholarship questioned because I
mhm,
was very unapologetic about helping black men and
mhm,
studying black men and the ways in which we are assets and we are strong despite the barriers. Like the system at a PWI just it doesn't comport with that approach.
mhm,
Um, and fortunately, I had enough mentorship before I started my program to help me better understand how I needed to move in this space. And I'll also call out the fact that it's critically important as conscious black men
mhm,
to invest in self-care measures that can help you not just survive but thrive hostile, toxic environments. And
mm.
so, for example, I was advised, and this is because of my experience in med school. I was advised that if and when you pursue your doctorate, get a therapist.
Wow.
And so I did that in the fall of 2018. I got a black my psychologist, and I would see him regularly. And as my self care regimen evolved, it evolved into yoga
Mm,
and breath work and journaling and
yes.
just chiropractor, acupuncture. I mean, just a whole breadth and depth of ways in which I could take care of myself while going through this program and then getting married and then having a son
Mm.
who is now 4 months old, right? And so, and then, I can't, I'll be remiss if I didn't call out my fraternity brothers
Mhm,
of Alpha Phi Alpha, who since college days have been, uh, I literally wouldn't be where I am today without the support of my fraternity brothers.
mm.
And again, that gets back to my interest and passion in giving back and serving as an example, as as an exemplar, as a template, as a paradigm of how to thrive and be comfortable and confident in who and whose you are as a conscious black man in any space and context. And so, what's interesting as well is that during my program at GW, the transition from a doctoral student to a doctoral candidate involved taking a comprehensive exam.
Okay. Okay.
I failed my health policy comprehensive exam twice.
Wow.
Um, and the the university policy was that if a student fails the exam twice, that may be grounds for dismissal from the program.
Mm.
So you can imagine, like I was like, look, I've already left med school, like because they're trying to kick me out
Right.
there. I'm not leaving here. So we got to figure out. Let's let's let let us figure this out.
Mhm,
So I talked to my chair, and we, and so as my chair and I walked through, the exam, and my chair is an older white man.
mhm.
He tells me literally that I am too smart for the test.
Hmm. Wow.
I'm like that doesn't make like on the surface doesn't make any like I'm too smart for the test. What do you mean? And I got it because my argument as well is that the master's tools are inferior.
Mm.
The exams, the tests that are
Yes.
used to assess
Yes.
people are inferior, and definitely
Mm.
for Black and Brown people, like because those inferior assessment tools,
Mhm.
GRE, LSAT, SAT,
Yes,
MCAT,
absolutely.
what um, I would argue are inferior assessment tool. And so what happened was that I'm, and so when he told me, I was like you, so he said, yeah, I mean, you like, he said, because of your lived experience and your background, like you have so much that it's not even like it just can't, it doesn't fit the context of these questions
Mm,
like you. And I'm like, that's so it's so weird, but I get it though, because
yeah.
it was the test wasn't designed for a certain way of thinking or for someone who to have a certain background. And so what happened was that the grading committee, they said, because they were puzzled, they said,
Mhm.
okay, well, I mean, he's, he's failed it twice, and a policy says, I mean, we got to kick him out.
Mm.
Now, what happened was that during that time, I had been, I had gotten so far along with my dissertation that they couldn't not pass me.
I
And
got you.
so and so they ended up, passing me and letting me move forward. And so it's just, again, so that,
Wow.
and so now, and what's also interesting is that my colleague, I didn't have a good experience with my my, my cohort. It was very
Mhm. Mhm.
isolating,
Yes.
and they tried, this, that, and the other to try to get me off my square, but I was able to get the support externally from the program to be able to finish. And despite all of what they were doing, and I have the degree in hand. I have
Yes,
the
yes. Yes,
dissertation.
sir.
This is the evidence. This is the bona fide, indisputable favor, is what will get
Yes.
me through the program. That and that's and that has been, to your question,
Mhm.
has been the reason why I titled my book indisputable,
Mm.
the story of a favorite son, because my lived experience has been that it's not so much that it'll take my network or my or my background or my qualifications or my credentials. It is going to take, as a Christian and as a man of faith, the favor of God
Mm.
to get you through, and whether it's a program or a job. And so that has been the story of my life, which is why I titled my book that, to demonstrate that it takes support, it takes core values, um, it takes character to be
Mhm.
able to live your life fully and to trust the process enough to get you to where you feel that you want to go. So I'll pause there.
Nah, that's he could have kept going. That's that listen. Wow. Talk about just bringing it all together. I think that you touched on some experiences that fortunately, I've been an HBCU grad my whole collegiate career for my
Yeah.
undergrad and my MPH. So I haven't personally experienced some of those things, but my wife just finished her PhD, and
Mm,
definitely when it comes to the toxicity of the
mm,
cohort, that is something that I witnessed firsthand. And it was shocking to me because I was like, wow, you would think in these elite institutions and
right.
these prestigious institutions, they would have people who treat other people like human beings. But this is just, it's like, this is just as vicious and
Yes,
as racist as
absolutely.
anything that we see out
Absolutely.
in the real world. This is really where it's happening. And so I can only
Absolutely.
imagine there's a powerful statement that I could have used when I was doing my fellowship after I left Morehouse School of Medicine, and got into one of these big organizations, which is, being a conscious black man. I
Mm-hmm.
think that for me, just even hearing you, there was power in hearing you even just stating that.
Mm-hmm.
Because for me, I was so stuck on, man, I'm young. I'm in a post-racial world. Like I can be a little bit more covert with my intentions
Right.
here. Like I can make everybody feel that I'm on my side. And it wasn't until I got into healthcare, I got on the front line with, clinicians, with the administrators that I saw, oh no, I have to be myself unapologetically in this space
Hmm.
because the problems are so severe, they're so stark, and they're so normalized at
Hmm.
this point. If we get these opportunities, I think you have a quote about just being at the table, but if
Hmm.
we get these opportunities to be there, like we got to use our voice. We have
Absolutely.
to, we can't try to assimilate and
Uh-uh.
conform
Right.
because you really, we'll be looking at the results like, oh man, what can I do about this? So
Right.
with this being said, you've done an amazing job being very vivid with your story. I want to kind of pivot
Hmm.
into your research, into your
Sure.
work. Let's get a little
Yeah.
granular here. So the title of your thesis, when you first shared it with me, I was like, "Oh, this is amazing." I have never even thought. I'm not even thinking like this. So it goes to show just how important it is to have the Dr. Enyas in the position where we
Hmm.
can have the first African American president
Hmm.
make something as major as the Patient Protection Affordable Care Act, and now we have a policy expert actually studying. Okay, well, what has this done for the brothers? So the
Absolutely.
title of your thesis is The Impact of the Affordable Care Act on Access to Care for Black Men and White Men, Implications for Policy and Practice.
Hmm.
Sounds amazing. Can you just just go with,
Sure.
how this started? What were some of your findings and what inspired you to really pursue this research?
Sure. Yeah. Yeah. Thank you so much. So, yes, um, my study was literally the first of its kind to examine the Affordable Care Act and its impact on access to care for Black men. And and one of the reasons why it was the first of its kind was because in the literature, well, one, like Black men are either hyper visible in the criminal justice system and or invisible in public health policy.
Wow. Okay. Very true. Yes.
And so unless and until there is some intentionality around supporting Black men in terms of their health, well-being, and access to care, we're going to continue to have the significant gaps that I found in my literature, and
Hmm.
which I look forward to filling as my kind of my career grows and evolves. And so now I found that so while the ACA it did achieve one of its goals of expanding health insurance coverage to millions of Americans, what it did not do or where it fell short because the assumption was that if you are able to expand coverage to people that naturally that would increase people getting access to care. My study blew that out of the water. I said no. So while for men, my study found that close to 50% of men who were uninsured were actually now able to get insured because of the ACA, which is great or better. However, when it comes to men and Black men in particular, actually having someone to go to for their health care,
Hmm.
a doctor, a dentist, a nurse,
Ah,
PA,
right.
um, that was not improved at all. In fact, from 2011 to 2019, which was my 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 testing parameters, the proportions of men and Black men in particular who didn't have someone to go to actually increased.
Wow. Hmm.
And so I was puzzled. I'm like, well, like on the surface, it makes sense that well, like in my mind, as well as what was found in literature is if you if you increase insurance coverage, that'll make it easier for people to go see someone to get access to care.
Right.
That didn't comport with my national data set
Mm.
that where I use key variables to examine the ACA. And um, so we have a lot of work to do because, and in terms of my policy and practice recommendations, one of the recommendations that I propose is, and I found was that, we have a strong infrastructure in place in terms of trying to meet people where they are.
Mhm,
Whether
mhm.
that's at the barbershop, that's at the I don't know, church,
Yes.
wherever, right? But there has not been a sustained intentional investment efforts in supporting interventions in the communities um, that have historically been disenfranchised uh, to uh, help help to facilitate greater access to care. There is not enough good messaging
Mhm.
about why it's
Yeah.
important to go find a physician. Um, it there are not enough culturally humble healthcare providers
Mm.
who are available um, to be seen by patients, and definitely not black and brown patients. And
Right.
so, because you have at the national level, about five to 6% of doctors are black, and then for black male doctors, only 3% around the country
Mhm.
of doctors are black. So, um, now I'll also say that I have created and coined what I'm framing as, and this is because of my background in Congress as a policymaker. I'm
Mhm.
framing what's called a policy, advocacy, and action framework for Black men,
Wow.
whereby people who have a vested interest in helping to support the health and well-being of Black men, there is an approach, a step-by-step process by which you can connect with staffers on Capitol Hill or
Mm.
at the state level to make the case or to advocate for the need to support the health and well-being of not of men, yes, but definitely Black men. And
Mhm.
um, so I now have access actually to the NIH um, um, All of Us program
Okay, excellent. Awesome.
to help me further operationalize my my research questions that I am thinking through right now, so
Mhm.
that we can make sure that we have a seat at the table. Because, as I say all the time, if you're not at the decision making table, you are on the menu.
Mm.
And as a staffer on Capitol Hill, where I have been again one of a few in the room where when we have been drafting policy,
Mhm.
uh, had I not been in the room to either call things out or to say, "Hey, time out," or let's ask a different question.
Mhm.
Outcomes or the language or the narrative in the bill would have been weaker
Right.
or not nuanced enough to help Black and Brown people. So, I have a lot of ideas and a lot of ways in which I'm trying to
Mhm.
get at what the impact that I'm trying to have. But yeah,
Fascinating. Very, very fascinating research. As somebody that sits in a health administration space at this point, it's always fascinating for me to kind of go into a policy rabbit hole. Because, you know, on our side, when you say ACA, most people start talking about value-based care, start talking about
yeah,
population health outcomes. This is how we've managed to do it as a healthcare system. It's great, it's nice. And we on this platform, we've had a lot of physicians who kind of share their perspective on what's working, what's not really working, and what we really need. And just hearing you kind of speak about that particular time range because that's a good 10 years to really be able to evaluate, okay, like what's happening. Without the other domino effects to fall, yeah, it just kind of, yeah, okay, great, people have coverage now.
Right.
But to your point, I'm thinking like, yeah, well, what, when we are expanding coverage at the same time, is that necessarily incentivizing hospitals and health systems
Right.
to all of a sudden start, creating more services and zip codes where
Exactly.
these folks are going to be targeted?
Right.
Is that incentivizing people really getting into, healthcare and producing more physicians?
Right.
So it's so interesting on how much more integrated we need to be just from a decision making standpoint in
Absolutely.
all of the different parts of the machine that is healthcare. And I think you also spoke to something that I would be remiss if I didn't ask you about is your experience as a staffer,
Yeah.
on the
Yeah.
Hill. It has been, for me, I would say that George W. Bush was the first president that I remember like knowing, okay, that's the president. But I was an Obama kid. I always tell kids that are younger than me, I had the privilege of growing up and
Right.
literally being conscious
Uh-huh.
during Obama. So my expectations, my just perspective of America was significantly shaped
Mhm.
by all of the policy that I was seeing being pushed. DACA,
Right.
the advances and gay marriage and the things that
Mhm.
he's done. So for you being this conscious emerging black man, having this inspiration, having your grit, having all of your experience, what was that like, that experience like being a staffer? Because I can imagine that was eye-opening.
I am a policy wonk. I love all things Congress.
Mm,
I like being on Capitol Hill. I was I found that I was always in my element. Like I loved the being close to the power. I loved the brilliance staffers, that were there. I'm always going to be a Hill staffer. So, I have colleagues that I've have met and I have cultural and, and I've built relationships with, for the past decade. And so, um, because of my experience, again, kind of being a health staffer on the Hill and being in a room when things happen, um, having the opportunity to draft legislation that has been now enacted into law, is such a special privilege. And again, it's for me, it's the favor. It's not so much like my credentials or anything, but it's actually what is the purpose? Like, why am I given the privilege and the blessing of literally sitting in a room across the most powerful people on the planet? Um, and so but it is to accomplish what is now being done. The fact that I have this credential, which will get me into more rooms, and because of my lived experience, um, I now can have a greater impact in any space and context as a conscious black man. And so, um, yeah, I love all things Congress. I was blessed to work on a Senate committee that was bipartisan in nature, where people actually enjoy working together to get things done. Um, a lot of receptions, a lot of happy hours, a lot of fun, but we also worked very hard. A lot of long hours. I would meet with voters and constituents and CEOs. I mean, it just kind of spanned the gamut. Like folks that I would meet with, where they would share their story, and I would take notes, and I would take it to my colleagues in the office, and discuss ways in which, we could help this person or these uh, voters or this audience. So it was, on any given day was, it was different. I part of it looked like, meeting with constituents, um, helping to organize hearings or briefings. And so, for example, I don't know if you kind of watch um, C-SPAN, but typically, so I would be the guy who would be sitting behind the senators as the hearings were taking, right. So I'm that guy who would staff the boss and help the boss answer questions because I did the research to help that boss answer questions, and I would be that person. And so I enjoy, I really enjoy being, in that setting. And again, being, typically, like the the few, black staffers. Um, it was such a privilege, and I think I'll also say that because of my experience, I found my voice in terms of the focus that I want to have post my time on Capitol Hill. And so now that I am where I am today, um, I am better able and equipped to advocate for and on behalf of Black and Brown people or those who don't have a voice.
That is excellent. That is thank you so much for sharing that experience as well. My mind is actually going in a lot of different places. I think that um just who you have been and how you have been able to just continue to like embrace every single environment really to me is good advice to have. I almost kind of wish I could have watched your professional journey like a TV show when I was getting my MPH. No, I'm thinking here like, man, I wish this was like this was documented so I could have saw this because I think that I know so I have plenty of my colleagues, plenty of other brothers that are interested in health policy or health administration or management, but we don't see ourselves there. You don't see yourselves in these spaces. Even when you get the internship, you don't see it. And so
Yeah.
I think I'm definitely going to be intentional about just who I send this particular episode to because I feel like it's just great. It's amazing, really, to hear your story. It's very encouraging and it's also inspiring, right? And I really genuinely feel like even though I'm on my path, I'm like, man, he's making me feel like I could do anything. Like he's really like I like he's just has been so centered and so focused. And I think that's the thing that I'm really impressed by. I want to ask you, speaking of your focus,
Mhm.
this year is an election year.
Yeah.
Yeah, every other day it hits
Go.
me in the face
Go.
that,
Yes.
that this is a big year. And we're just continuing to see how we evolve, how we do politics, how we talk about things.
Yep.
So actually, I would actually just want to know from your lens, from your expertise, what is on the rise? What is kind of piquing your interest? What are you paying attention to as we lean and move towards November?
Yes. Great question and very timely. So I read an article this morning that talked about what voters are interested in seeing as the candidates on the camp on the campaign trail are moving, and in the context of healthcare and coverage. Unsurprisingly, because of how the ACA evolved politically, those who lean left, they so kind of in general, um, voters do want to see candidates be very intentional about talking about health, healthcare, surprise medical bills, medical debt, um, other facets of what's happening. Now, where that diverges is political, right? It is party. So those who lean left, when asked, if the ACA has been helpful, they tend to say yes. Or there are more people that lean left that say yes, that the ACA was helpful. Those who lean right or are Republican say no, right? And I mean that is to be expected given how the ACA was politicized and that whole process. So we get that. Um, I will pivot my answer to your question by saying that we also know, in the context of having healthy a healthy democracy, that there is a direct link between your level of civic engagements and health outcomes. Meaning that if you are a well-educated voter, you are one more likely to vote, and two, you're you are more likely to live better. Um, and so we have to get to a place where those who are leaders in the advocacy space, for example, we have to continually beat back voter apathy
Mhm.
and make every effort to connect the dots for the general public and why it is critically important to vote up and down the ballot.
Mhm.
Local, state, federal, judges, mayors, school board. And so I also will say that one difference that I think is of note is the extent to which families or families or or communities talk about policy and politics and just in general. I know and we know that it can be divisive, but I believe in creating a culture of talking about policy, or just kind of, in fact, I'll say talking about civic engagement, and the political process in ways that attune the general public to getting involved, um, so that they do go vote. Now, another part of this too is who who is voted into office,
Right.
and how do we how do people get the people that they want into office,
Mhm.
who align with values and interests. I'm not saying that you have to agree with all of the things that someone you know talks about or wants to do, but it's about finding ways to get engaged, um, to ensure that we have a ultimately a check and balance, a healthy democracy where we all are thriving. So,
Mm.
yeah.
I love that. You made some very important distinctions. Number one, I think it's very nice to hear kind of you end on that note because ever since I'm working, ever since I started actually my job in healthcare, I have definitely become much more politically aware. And I was always like, I think I was born in 95. So I would say as a young millennial, I was one of the hothead, like revolutionaries, let's burn it down kind of people. So I was aware, but I never was really tracking at a local, state, or national level. Okay, what policies is is this leader, is this representative really pushing forward? Really, what special interest groups really
Yeah.
back this person so I
Yeah.
can know some of the secondhand things that I may be voting for. And I love though how you phrase it for it's less about the voting, it's less about even policy. Let's call it civic engagement.
Hmm.
Let's call it just like getting involved
Right.
with the community and being able to learn how you can make some things better for your community. Because I do think, while just as a culture, we are dealing with a lot of different things, as we always are, every decade we are.
Hmm.
I feel like there is a growing awareness. I see more people online, starting to have good conversations about what we're really actually voting for at the ballot box. I would, even want to branch further, but I'm not going to on this thing that's happening on the left right now. Actually, I guess I am going to because I mentioned it to you. But and this we could kind of also end because I know we're
All right.
coming up on an hour here. But I have my understanding of before I even call it the left, just the Democratic Party. Again, I was born in 95. My parents, one of my dad was came up during Jim Crow. My mom came up during the hippie movement.
Mhm.
So they were pretty, I would say, socially liberal, a little bit more fiscally conservative because they were
Mhm.
entrepreneurs, but always just im- I always assumed we were democratic. I always assumed that's how we went. That's how we, this is how we voted. And then of course, the typical narrative that's projected to you as a young person in America is like, hey, these guys are for, what's
Mhm.
right. And that narrative was not challenged until 2016
Ah,
because Bernie Sanders was the first
there it
candidate
is.
as a presidential candidate that I was like, "Oh no,
Wait a minute.
this
Right.
guy is what I'm about." All you
Uh-huh.
other guys, I
Right.
don't know what y'all been talking about.
Uh-huh.
He is talking about how I really think the country should go, and I just believe that the party has not done a good job trying to mend that fragmentation ever since. And I
Mhm.
get nervous because I'm like, man, on the other side, these guys are falling in line, and it's
Mhm.
everybody got the
Yep.
script, and it's
Mhm.
very, very clear to their constituents how
Correct.
they're rocking. But with us, how do
Yes.
we get to a point
Yes.
where there's more harmony? That's because right
Yes.
now, that's what I see.
Yes. And that is an accurate assessment. And I love that you brought that up because, and I'll say this kind of come up on time, but um it is it is critically important to, so I'm not a big fan of the two-party system. Let me just kind of lead with that. But
Yes.
it's but it's in place currently, right? I mean, I'm about to
Mhm.
kind of work through it. Um, I am someone who, while I tend to lean left, I'm also conservative in some aspects. And frankly, I'm also kind of independent on some things. And so, but I also enjoy getting people into office in terms of whether that is fundraising or to help to kind of um help to manage their campaigns. And so, but yes, um, people like Bernie Sanders, I love the fact that he is unafraid to call things out and to hold people accountable in ways that bring a different perspective to the conversation. Um, and so, while we have currently a two-party system, um, I do believe as a what as kind of what I'm framing myself to be as a tempered radical, meaning I can
Hmm.
work in the system, but
Okay.
also work outside of the system. So I understand how to move in both systems, and I think that I noted earlier, part of it for me is I can either disrupt, dismantle, and or transform systems. Um, and I've had to learn how to do that over the course of my career. And so while the system that is in place with the two parties is is there, um, I do believe in getting into the system to effect change, but also holding people accountable in ways that help to kind of disrupt things in ways that bring about change. Uh, um, so yes, I am someone that I think I've learned how to, kind of navigate, uh, 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 kind of across the span of the left and the right to understand where people are coming from. Um, but unless and until there is enough of a movement to create a viable or a credible third party system or some other ways to, then we are going to have what we have, and we have to learn how to work within and without the system. I think is the big takeaway. It's like, while on one hand, yes, there are certain policies and approaches that resonate with your own kind of wiring. It's also important to keep in mind that we do have a system that is in place, but how do we disrupt it in ways that agitate the status quo enough to make some type of positive change writ large. So yeah,
Wow. I love that with and without the system. And tempered radical may be a term that I have to start
yeah,
using because I always encourage, my peers. I'm like, hey, we gotta be in these spaces and we have to at least try to do something, because I
absolutely.
think it's easy to get to your point when you're in these spaces, when you have these opportunities, there is like a general, more, conformed mission. For me, it's the business and focusing on healthcare as a business and all that. But you have to use the opportunity to actually change. And I think it's okay to have your lens and try to do the work through the political lens that because that's one of the things that I think I experience more now in the workplace is just like, wow, my outlook and my ideology actually very much so influences how I feel I should do this, how we should do this work, so
Yeah,
much to so that I have to learn how to work with and bring in other ideals and other values. Otherwise, nothing will get done. And
right.
I'm encouraged by individuals like yourself who are even comfortable in saying like I lean left, but hey, I'm conservative on certain issues because I think for a long time just the inclusivity and the
Hmm.
diversity
Hmm.
of within actual parties was not something that was known about. And I feel like as people become more aware, we're seeing that even though it's two party,
Hmm.
it's a whole lot of different kinds of people that are flying under these names, right?
Yes, yeah,
So it's bless you.
yeah, and I'll say that to your point earlier, Dems tend to be very wonky, and we are labeled as elitist, and all of those things.
Mhm.
We're not. Dems tend to have to be very challenged with messaging and kind of coalescing around someone despite their personal angst with that person.
Right.
People who lean right, they are brilliant at messaging, just giving simple messages, staying on message. Let's coalesce around this person
Mhm.
because because we want to maintain the system that's in place that
Right.
has kept people like us in power. Whereas, and so yeah, so that's a very valid observation that you made, where those who lean left, it's been challenging to actually like. It's fine to take a deep dive into policy, and that's like I get it, but you're also trying to reach people where they are and what messaging or narrative resonates with their emotions, and like,
Yes.
what I'm saying. So and that's easier. Those on the right can do that, tune into that easier, as opposed
Yes.
to those who lean left. And I've long argued, look, man, we gotta those who lean left, like we've got to do better. So
Yeah. The messaging since, well, particularly 2020 is very interesting to
mhm,
me. I'm always like, who is making these decisions?
exactly.
But I appreciate you, Dr. Enya. I will go ahead and wrap us up. This has been an amazing hour. One of our longer episodes, but every second was worth it. Absolutely. So I appreciate you. I know the team listening back, they missed out on an excellent conversation, so they'll appreciate you for joining on. In closing, is there anywhere on the net that people can find you, connect with you, a preferred social media platform for people to reach out for our listeners?
Absolutely. So you can find me on LinkedIn as my first and last name. You can find me on IG as Enya Strategies. That's ENYIA Strategies. You can find me on TikTok as the same Enya Strategies. My website is Enya Strategies. So you probably will be able to Google my name, and you'll find all of my socials there. I'm also on YouTube as my first and last name. So and also Facebook, of course, with, with my first and last name. So happy to be helpful. My book is out there, so feel free to reach out. It's on Amazon and Kindle. So, but I look forward to talking more with you. I thank you so much for this opportunity to share my story, and I look forward to what's ahead.